Hey everyone, if you're gearing up for your boards, you are in exactly the right place. In this explainer, we are doing a super high-yield review of the key statistics you absolutely need to know on anesthesia risks and complications. We've boiled it all down to the essential numbers to help you crush your exams. So here's our game plan. We're going to start with the most serious outcome, mortality. And then we'll break down common complications you'll see in different patient groups. After that, we'll dive into the cognitive risks, specifically postoperative cognitive dysfunction. And then we'll wrap it all up with a rapid-fire review slide that has all the must-know facts. All right, let's jump right in with mortality. We have to start here, because understanding these core numbers is really the foundation for how you stratify risk for every single patient you see. Okay, here's a classic board-style question. You could totally see this exact scenario on your exam. It's a common situation, and it really highlights the risk in one of our most vulnerable populations. So take a second and think, what does the data say? The number to lock in your brain is 8%. This single statistic tells a huge story. Age, all by itself, is a major independent risk factor. In fact, for every single year over 80, the relative risk just keeps ticking up. But, it's never just about age, right? Your boards are definitely going to expect you to know the other big players. So remember, emergency status, that's a huge one. And the invasiveness of the surgery, especially those big abdominal, aortic, or thoracic cases, those are powerful independent predictors too. And of course, major comorbidities like heart failure can really change the entire risk profile. Okay, so we've covered mortality. Let's shift gears now to the most common non-fatal complications. And we're going to start with a population that has its own very unique set of risks: kids. For pediatrics, it's all about the airway. When you think peds complications, your first thought has to be respiratory events. They are by far the #1 issue you're going to face and a huge focus on any exam. This chart just spells it out for us, doesn't it? Look at that. Respiratory events like desaturation and laryngospasm are leading the pack at almost 24%. And right behind that are two other classic pediatric challenges: PONV and, of course, emergence agitation. Now, this right here is high-yield gold. You absolutely have to know this comparison. The data is crystal clear. Emergency procedures in kids have more than double the complication rate of elective cases. That's a 2.1-fold increased risk, a number that is just begging to be on your boards. And remember, it's not just about urgency. Age is a massive differentiator in this group. That smaller, more vulnerable airway in kids under 3 years old, well, it leads to a significantly higher rate of respiratory events. The complication rate is nearly double that of older kids. All right, let's switch gears again. We've talked about respiratory risk in kids. Now let's focus on a major neurologic complication, especially in our older patients: postoperative cognitive dysfunction, or POCD. This is a huge topic in research right now, and it's very, very testable. Okay, first things first, let's be super clear on the definition. POCD is its own thing. It is not delirium. We're talking about more subtle but very real changes in things like memory and attention that can stick around long after a patient goes home. So here's a question that gets right to the heart of it. Think about your highest risk patients, the ones going for those big, physiologically stressful procedures like a CABG. What kind of short-term cognitive hit are they taking? The number is just staggering. It's between 50 and 70%. In that first week after major cardiac surgery, more than half of all patients are going to experience some degree of POCD. That is a critical statistic to have in your back pocket. And here's the kicker. It's so important to understand that this isn't always some short-term blip that's gone by the time they're discharged. For a lot of these patients, the cognitive changes can linger for months. And this is the stat for that long-term impact. A shocking 10 to 30% of cardiac surgery patients still have measurable cognitive deficits 6 months down the road. It's a sobering reminder of the lasting impact our work can have. So you might be wondering, what's actually happening on a cellular level? Well, this diagram shows one of the leading theories. The idea is that volatile anesthetics might trigger this huge release of calcium inside the neuron. This then floods the mitochondria, which kicks off something called a caspase cascade, and that ultimately leads to apoptosis, basically programmed cell death. It's a complicated pathway, but the key takeaway is a potential link between the agents we use and neuronal injury. Okay, we have covered a ton of ground. Let's boil it all down into one final super high-yield summary slide. This is the one to screenshot. These are the essential numbers you just need to commit to memory for your exam. Here they are. Know these numbers cold. 8% 30-day mortality for inpatients over 80. 23.5% for respiratory complications in kids, the 2.1-fold increased risk for peds emergencies, and that almost doubled risk for kids under 3. And finally, the 50 to 70% short-term and 10 to 30% long-term hit from POCD after cardiac surgery. These aren't just random stats, they pinpoint our highest risk scenarios. And as we wrap up, let's bring this all back to the bedside. Because these numbers, they aren't just for passing an exam. They represent real patients and real risks. Thinking about these statistics should directly change how you do your preoperative assessments and how you build your anesthetic plans, helping you get ahead of these risks every single day.